Do you do this to your nails? You could have a nail picking or biting habit, also known as onychotillomania. So there's a group of disorders in dermatology where people do things to their skin, whether it's nail biting, lip biting or picking, or even pulling or tugging at your hair. This condition in particular is called onychotillomania, or nail picking biting habit. And this is a really challenging thing to deal with. A lot of people do this to manage their stress. It's almost like a way of distracting yourself from feelings or things that you don't want to process. And so people take it out on their skin. It can be problematic because it can lead to permanent nail changes if you're continually doing this to your nails. They can grow out abnormal. Sometimes you can even get infections around the nail folds because you're picking or biting and disrupting the normal nail unit. And then you can get infections such as paronychia, which can then lead to other complications. Treatment is really focused at trying to reduce this habit. And a lot of it has to do with recognizing that you're doing it and training yourself to do something else to distract yourself or deal with those emotions or feelings that you're trying to distract yourself from. So there's actually something called CBT, or cognitive behavioral therapy, that's used a lot in psychiatry to help people do just that. Other things that people have tried is putting something that tastes really bad on your nails, whether that's hot pepper sauce or nail polish or lacquer that has a really bad taste, to try to deter yourself from doing that. Or you can distract yourself in other ways. So for example, using a stress ball to get out that need to do something with your fingers. If you're struggling with sores or cracking in your nails or around your nails because you have this habit, one tip I have is you can go on Amazon and buy these silicone finger sleeves that you can use. And so you can put on a nice moisture barrier, something like Cicaplast or Vaseline in the areas that are really hurting you, and put these silicone sleeves on. And that helps protect and moisturize and heal your nails, but also prevents you from causing more damage. The last thing that you can try is there's actually a medication called NAC, or N-acetylcysteine. It's actually given IV in people who have Tylenol overdose, but interestingly, they've also found that it helps with impulse control. So if you have this desire to pick your nails or bite them, it actually helps to recalibrate the chemicals in your brain to reduce this habit. It's actually an amino acid or a protein type molecule that is available over the counter as a vitamin at a lot of natural health supplement stores. And it's basically a tablet that you can take. The recommended dosing is 500 milligrams twice a day or even 3 times a day. If you're on other medications like antidepressants or anti-anxiety medications though, it's important to check with your doctor before you start adding things in. So that's just a little summary about nail biting or nail picking habit. If you struggle with this disorder, maybe leave a comment down below in terms of how you've managed this and how you've overcome this habit and what things you've had to struggle with. Thanks for watching, guys. We'll see you in the next one.